welcome the attendance of members of the school district community to view your school committee as it conducts its regular business. Not designed to be an opportunity for dialogue. So that while we will not be immediately responding to your comments or answering questions, we are listening and paying attention to your concerns. During the meeting, items that are listed on the agenda. If you are attending online and would like to make a comment, please put your name and chat. Please do not make any other comments in the chat. We allow 20 minutes total for public. I ask each person to limit their comment to 3 minutes. I will be timing the comment, warning at 2.5 minutes. After public comment is over, the chat function will be turned off to allow us to devote our full attention to the meeting. Because our meeting tonight is in a hybrid format, I will be alternating between online and in-person comments. Okay, those are the rules. Is there anyone here who would like to make a public comment? Tina. Yeah. Stand right there. Just get your name and town.
Oh, Tina Lane, Essex. It's been a year since the anti-racism resolution was adopted by the school committee. At that meeting, the committee said that they from X. Kennedy's book, How to Be an Anti-Racist, more about anti-racism. I have been reviewing the policies for the district and I find no policies that allow or promote that promote unequal opportunities. I think that the school committee was urged by an unelected body, the Mass Association of School Committees, MASC, resolution. Our district is not committing. By adopting it, our school committee is speaking to the members, and I, as an Essex citizen, object to that representation. I would like the school committee to retract its support of this resolution because we were already aligned with its ideals. We don't need to sign on to a document that certifies that we act in accordance with MASC. Interestingly, this spring, MASC issued guidance for school committees on how to deny that schools are teaching critical race theory. Perhaps the school committee should not hastily bend to group pressure, especially during riots and a pandemic. The school committee should act in the interest of the taxpayers of the region and not outside groups promoting their agenda. The school committee should not allow our teachers, staffs, and towns to be bullied into accepting the label of racist. To anyone that is unhappy being called a racist, afraid to speak up, I would like to share this quote. The health of a democracy is measured by the percentage of people willing to say what they actually believe in public. Tina Lane. Thank you.
Thank you, Tina. Okay, do we have people in the chat who would like to make a public comment? I don't see any. Is there anyone else in person who would like to make a public comment? Oh, would Tara,
I would like to make a comment.
okay, great. Who is that?
My name is Jeff Rubin.
Okay. Go ahead.
Let's see if I can figure this out. So do you want me to just speak without going on camera?
Oh, up to you.
Okay, I'm trying to figure this out.
All right.
Okay. Seems like it won't allow me to be on the camera. So my comment would be to urge this committee and the school to not allow masks to be mandatory for kids at the school this year. What we know about COVID is that it is very real. It has been a deadly virus for people immunocompromised, for elderly, and for a small subsection of people worldwide. In our community, WCVB Channel 5 reports by town the number of COVID cases. In checking the statistics today, there was 2 cases in Manchester by the Sea and 6 active cases in Essex of the entire population of 8,000. That includes every man, woman, and child of every single age in every single immunocompromised situation. The reality is that our kids in our communities are just not getting COVID, nor being hospitalized, and thankfully not facing worse consequences. We're just not seeing that as a reality. And this is why Governor Baker has chosen to allow us as communities and U.S. school committee to assess individually what's happening in your community, such draconian decisions as masking up children and forcing them to be restricted in their breathing and not see each other's faces for at least 6, if not more, hours per day. We know that the COVID cases are low, extremely low, and particularly among children. And we know that it has been decreasing the severity of COVID and the new variants. And we know that recently this Provincetown highly publicized variant showed that the average age of a person that had a so-called breakthrough was 82 years old. I would strongly urge this committee to look at the fact that as the COVID cases decrease and as it becomes minuscule amongst school-age children, what alarmingly is increasing are the psychological and socially devastating consequences to children. An increased depression, increased suicide.
I just wanted you to know.
And I would just ask that the schools strongly not mandate masks for children in the school year. Thank you.
Staff. One.
Carla Christensen is in the chat.
Okay, Carla Christensen. Comment?
Hi, everybody. Thanks so much. My name is Carla Christensen, School Street in Essex. I'm the parent of a entering 6th grader this year, too young to be vaccinated, as are many of his peers in the 6th grade. I'd like to ask that MARSD implement a masking policy for students and adults that actually goes beyond what the department and the governor have currently recommended as guidance. Our COVID cases are low, and the way we keep them low is by staying strong, by wearing masks, by recommending everyone getting vaccinated. So I'd ask that we take another look at that. Everything possible must be done to keep our kids healthy. There's no question about that. I want to see the other side of this pandemic. I want to not be losing friends and relatives anymore to this pandemic. The American Association of Pediatricians has recommended that all eligible individuals receive a COVID vaccine as part of their safe return to school. And they recommend a universal masking policy at this time. So I'd like NHSC to take a look at those. Thank you so much.
Thank you, Carla. Okay. After Carla, Miranda Godet.
Hi, that's me. Hi, guys. I would like to make a public comment about, I live in Manchester on Woodholm Road. And I would like to make this comment on behalf of myself and the Howe family. We, at the end of Woodholm, this is about a bus route. At the end of Woodholm, the corner of Woodholm and Pine, lives currently a registered sex offender. And we would like to open up the possibility of changing the bus route so that the bus would come up further up Woodholm to potentially pick up kids at Woodholm Circle. That would enable the bus to turn around. I think we all would feel much safer allowing our kids to congregate there. And right now there are currently 5 families that would be affected by this. So from just a general comfort level, we wanted to bring that to the stage so that everybody is aware.
Thank you, Miranda. Thanks for letting us know that. reach out to Avi regarding any bus questions.
Schoolbus@mersd.org.
Schoolbus@mersd.org is the website for bus questions. Yes, okay.
Wonderful. Thank you so much. I'll go back on mute now.
Can I just say that you should be able to operate your video cameras at this point? Just let me know if you can't.
Okay, so if you want to turn on your camera, you should be able to turn on your camera now. And I think stuff is in the chat, but I can't see it right now.
It was just a Pam and someone asking a question about video.
Okay. No, Caroline says she would like to make a public, oh, no, I see it. Caroline, got it. Okay. So I think, anybody else here making a comment?
Said that there are people waiting.
Can you check and see if there are people waiting to be out of a waiting room?
You did not establish a waiting room.
Okay.
We don't have a waiting room set up. Okay.
Okay. Well, Annie, I don't know what to tell you, but people, we don't have a waiting room set up, so everybody should be able to get into the meeting who's there, and we do have 127 participants. Plus a few, handful in person. So I think that will.
Sarah? Sarah? Hello?
Who is that? Hello?
Hi, it's Nina. I'm on the phone. I didn't know if you're going through the in-person on the web and then to phone.
Very good. I did ask for a phone earlier, but if you'd like to make a phone comment now, we'd be happy to hear your comment.
Oh, I appreciate it. It didn't come through, and I appreciate it. I just wanted to bring up, knowing that, and I know it's later in the agenda, Nina McKinnon, Essex, Lowland Farm Road, in terms of just the masking component, as the first two speakers mentioned, it's clear that there's just different opinions, and no one opinion should be just the absolute. And that is really what this comes down to, is that parents should be able to be making decisions for their kids. This is about personal choice that really is coming out. As much as the American Academy of Pediatricians are giving their recommendations, they've also been, to quote, as of August 12th, children report 18% of COVID cases at this time. Severe illnesses due to COVID is uncommon among children. In terms of the mortality rate, it's 0.00% to 0.2%. Just in terms of how this plays itself out, the politicization of COVID, of masking, of being for vaccines, anti-vaccines, I would hope we could look, as maybe the first speaker said, as to what our communities have, because for the past 2 to 3 months, you go to Singing Beach, you go to Manchester, you go to Essex, you see all these kids, all these people outside, inside, not wearing masks, maybe wearing masks. People are making their own personal choices, and we have not been seeing this, a huge trend in a way that would make it so that the governor has to make a decision that impacts all of us. And so I just really was hoping, or wanted to put my opinion that, all of last year, the school committee, the multiple meetings I sat through, we heard that school-age children did not spread COVID. And there's so much social emotional well-being. There's so much impact, even from a health issue for masks, where we're seeing immunity issues now of winter colds that kids are getting in the summer because they didn't have an exposure last year, that I really hope the school committee can look at the big picture so that parents can make choices for their children, as opposed to making choices for us. Thank you.
Thank you, Nina. Okay, is there anyone else on the phone who wanted to make a comment? Oh, okay, yeah, go ahead. Can you just, if you can, that would be great, because then the owl can see you.
Hi. I'm Katie Vandy, and I'm an Essex resident. I'm also a registered nurse. So I would just like to make some comments on following up to the comments that were just made about a mask mandate. And I want to be very clear that I'm not making comments either for or against a mandate, but I am going to state some facts. It's a fact that last year, the majority of the school year was spent either remote or only doing 2 days a week in school, which was 6 hours a day for only 2 days a week. That's very minimal mask time. This school year would look a little bit different, where it's going to be 5 days a week for an unknown period of time, where if this board were to recommend a mask mandate, that this is going to be a much longer stretch of time, that especially younger, I think high school is a little bit different, school-age children I fall into a different category, I believe, the younger kindergarten through 5th. So if it was the decision of this board to mandate masks in the school, I think it would be wise to look at what other health disparities and social emotional disparities might come of having a child in a mask for 6 hours a day for 5 days a week. So I think if that's the decision of the board, that some other strategies are going to have to be put in place to keep our children back. So that's my comment. Thank you.
Thank you, Katie. All right, I think that's it. We're out of time for public comments, and I don't think there was anybody else in the list. So I think we can move on. I have a short chair's report. I think we should switch that to chair's report. Okay.
Yes.
So thank you for being with us tonight. I hope that you are all enjoying the last few weeks of summer. I know that people have a lot of questions and concerns about what the school year will look like. We understand that people are frustrated with the state of the pandemic and the decisions that face us tonight. Even if you do not agree with our conclusions, we ask for your patience and respect as we navigate the current situation. Please know that your school committee, administrative team, and teachers are all working cooperatively to ensure the best possible educational delivery for the children during these difficult times. Thanks again for joining us, and we can get started. Consent agenda. We didn't have much.
We have nothing in the consent agenda.
There is actually nothing in the consent agenda. Moving on to subcommittee reports. There are facilities report. We have a beautiful new facility across the street. There's got to be something to say about it. Nothing? Pam, Avi, do you want to say anything about Memorial School?
On time,
Facilities?
on budget, and we'll be ready to open up
Moving in.
the second phase with the beginning of the school year.
Playgrounds?
Playground, we are working through some issues with the surfacing and getting something in and ready for the fall. Essex surfacing went in, so that one's continuing side Memorial project. The Essex Elementary Playground is also tracking on time for the beginning of the year. I think just probably something good for the public to be aware of. It came up on our call today. The Memorial project's 3 phases, and phase 1 is the academic building that we occupied last year. Phase 2 is the auditorium, not the auditorium, the cafegimatorium, the music room, the administrative offices, the lobby, the cafeteria. That's phase 2, and that's what's going to be ready to go on day 1. Phase 3 is all the exterior landscaping and
cancer care can't wait.
necessarily be complete until November. So on the outside, it may look like, oh my gosh, we're not ready to open for the year, but the inside is going to be ready to go, even though they're going to continue work on the outside.
Awesome.
But Avi, you follow this minute to minute, so I don't know if you have any breaking news or.
No, I think
Great
that's a
tidbits
great
to share.
update. You know, the budget certainly seems to be continuing to be very good shape. We'll talk about bonds that are coming out at an amazing rate. In terms of interest rate, we're saving a ton of money compared to what we estimated for interest. And the building is coming along terrific as well. I think it's going to be really nice once we can get it open to the broader public, but
Awesome. Does the finance subcommittee have a report? Nothing exciting. The policy committee has something for us, a first read of our new school committee operating protocols that Eric and Kate worked on.
Yeah, everybody, I think Eric sent out a copy of that to everyone. I have a paper copy here if I look through it, but
Eric,
Yeah.
do you want to throw it up on the screen, or are you just going to read through it?
So I don't actually have, I'm away right now and I don't have the document up. So I didn't know if someone had a copy of it from when I sent it. I mean, I might.
That's okay. Avi has it and he's going to put it up on the screen.
Thank you, Avi.
Does one of you want to give just a little background about how we met with Dorothy Presser over the summer and she helped us with this?
Sure. Yeah. We had a school committee retreat that we do annually. Dorothy Presser came and did a presentation. And one of the core elements was establishing school committee operating protocols that we abide by. So Kate and I touch base and put together a draft of these protocols, and they're broken up into a few different sections. So this is a draft, but I thought it would be good enough to send to the group. So I'm trying to enlarge it. I can't really, my eyes are getting bad. So I'm happy to read through it if you want.
I think we need to read through the whole thing. I mean, this is
Okay.
really kind of an internal document for
Yes.
this.
Yes.
We're working together smoothly as a committee, and we can consider this a first read so that everybody on the committee can take a look at it, and we can take a vote on adopting it next time. And it will be posted online with the other minutes of this meeting if anybody from the public really wants to dig into our operating protocols. But thank you so much for
Great.
working on that. Anybody want to say anything else about them?
But I like that we're doing it.
That we're doing it
It's a
too.
helpful-
Yeah, I think it's going to be really helpful to just make sure that we all work together well as a committee. That's awesome. Thank you, guys. So then that was policy, and then we have not met for negotiations, so I can say that there is no report there. So Pam, on to you.
Okay, well, my report is primarily an update on the opening of school, which is
Oh,
for the
sorry.
most part, discussion of the COVID procedures. So
Yes.
if you're ready to jump in.
Let's go for it.
So if you're here, you can tell that I'm going back and forth between trying to figure out what shows up on my screen and is projected here versus what's showing up on secondary screen. So I'm going to do my best to throw my PowerPoint up so that everyone can see it and that it gets embedded in the recording. So just give me a second on that. So how does that look on your screens if you're following?
It's not up yet. Oh, actually, it's up on Kate.
It's up.
My computer's having trouble connecting for some reason.
Yeah, Pam, this is Chris. I can see it. It would be better if you went into presentation mode. There you go.
So I was looking through my notes from the end of last year, and my closing note in June was outlook for the fall, Operation Normal. Masking was the only thing in question. So we find ourselves right back to where we were in the spring. So just going to take you through a little bit of the thinking that's gone on over the past month and present you with my recommendation, and then it's for this group to discuss the merits and see what we want to do going forward. So just kind of as a quick backdrop to the recommendation I'm going to make, I think when we think about and reopening and taking into account that there are opinions, it's a politically charged issue on top of varying scientific perspectives on it. We are really trying to take a common sense approach to accomplish the following things, which is student health, student and staff health and safety first and foremost. We want to open and sustain full in-person operations. I think the comment that last year we were full in person from April forward, but with all mitigation efforts in place. We haven't really done this without any of the mitigation efforts. And our goal is to not have to revert to hybrid and remote because everyone is in agreement that that's the worst case scenario for kids. And then we want to minimize staff and student absences. And I think we've learned a lot about contact tracing and what happens when somebody has to be out for 10 days just waiting things out. So those are the things we're trying to achieve with the recommendation. Things that we've been thinking about as part of the discussion. And we are really running the gamut. There's a metrics component to it, and there's a desire to always want to pin it to metrics, but I think we've taken a more holistic approach because there's no one metric that seems to work and be definitive as things continue to evolve. And I think the Delta variant and the unknowns around that are playing heavily into the recommendations that we're getting from our external experts and the recommendation we're going to make for you tonight. So basically, number one, ensuring access for all kids. So when you think about masking, or you think about unmasking, we have to ensure that students with underlying medical conditions, staff with underlying medical conditions, or attached to households in which it's an issue, come to school and access the curriculum. That's a non-starter. They have to be able to come. So we would inevitably find ourselves in situations where either reorganizing classrooms or requiring site-based masks based on the makeup of a classroom, which I think gets us to some concerns around privacy issues. So number one, coming up with something that ensures access for all. Our current masking policy does allow for medical exemptions for students who can't mask. So it's between Billy and the doctor on that front. We want to support the local health team in discussions with the local health team, and that's not only our school nurses, but the public nurse from Manchester and our school doctor, Suzanne Graves. We've taken their expert opinion and I've taken that into consideration. We're looking at regional methods in place for that. We're considering that there's an availability issue with vaccines. Not all students are vaccinated. All of our youngest students aren't. We have varying percentages per town, particularly in that that second bucket, the 7th and 8th grader group. I think we're running at about 50% in Essex, higher in the 80% in Manchester, but we do have varying degrees of vaccination. And this is key, manageable to implement. You know, when you talk about having to do targeted masking for a particular class or changing class issues, we need a policy that it's just part of our daily operation. It's not something that we're spending an inordinate amount of time organizing, managing, and reorganizing and putting out fires around. We need to look at the number of staff and students who are indoors for an extended period of time. Again, to the comment made earlier, in talking with our public nurse and our doctor, the basic recipe is volume, so number of people in a location, an extended period of time plays a big role. And when we think about coming back to school, we're thinking about bringing all 1,300 students back on campus at the same time with another 250 staff members in an enclosed environment for 6.5 hours a day. So it's not like we're just walking into a store and out in a 15-minute period. We're going to be here together, talking, working, interacting for the entire day, 5 days a week. We also talking about relying on methods that have worked to prevent the spread in the past. So the one thing we have going for us is we know that the mitigation efforts that we used last spring resulted in very low transmission rates in school, virtually no in-school contact. And that was one of our champion points last year, is that we came through the year and we didn't have to revert to hybrid. We didn't have to close down many classes. It was pretty tight here in the building. It was a very controlled environment. We don't know, but doctors are telling us they don't really know what Delta is going to do. And I think the conflicting information is an indicator of that from a common sense perspective. You can talk to professionals who have different opinions on how this may play out. And I think if we start strong, so kind of leading you, probably know where I'm going. If we start strong, it gives us the opportunity to incrementally roll back as needed, with hopefully the goal of never having to go to the other end of our sliding scale, which is a hybrid or remote scenario. So my recommendation, after listening to all, and this is consistent with our public health nurse and our doctor, is that we follow the CDC prevention strategies and the recommendations, which is essentially masking indoors for adults and children, regardless of vaccination status, and making a 3-foot kind of elbow room spacing guideline. Not stringent. We're not talking about lines on the floor, but we're talking about setting up a lunchroom with desks 3 feet apart so people can unmask and eat individually and be comfortable. We think that, I think that covers the spectrum of need and achieves our priority goals. And I, again, would reinstitute the monthly conditions report so we can continue to get feedback from our local experts and look at the conditions to see how they may merit changes. Big picture, what does this look like? Modified spring 21. Basically, by the end of the year, we were going about our regular business and having a fairly normal school environment, but we were masking and distancing. And that's how we would look to open up the year. So just a quick overview. These are the strategies. You can read them, we'll post them. So consistent and correct mask use for physical distancing. I already reviewed that. Public admittance to the building, we're going to continue just making sure that people can have access, but they need to have an appointment. So we're going to try to curtail the walk-ins. And it should be noted, outdoors it's the free zone. There are no restrictions on outdoor activities. I'll do a quick aside. There was guidance that came down later in the day today on music, and they are continuing with the general masking. Pull those up and make sure the schools have them, but they are consistent with the CDC as well, and still recommending outdoor or unrestricted drama and music performances. One thing I was a little bit surprised, but they have encouraged us to go forward, our nurse team and our doctor and public nurse, to continue with the MedBot daily scanner. They felt that particularly at the elementary level, it gave them a really good opportunity to do an initial first screen. And it does, like I said, I was surprised, but it makes sense when we look at the other two efforts we're going to put in place, which is the symptomatic testing and the test and stay protocol. So the goal is to try to cut back on the need for quarantining outside of school. The nurses felt that having that first shot at talking to people who may have symptoms and encouraging them to stay home if they've reached a certain threshold would cut down on the need for unnecessary test and stay or symptomatic testing during the day. So they would like the opportunity to have a conversation with you as a parent before you send your child in with symptoms, and then you're in the nurse taking a test, because we cannot force the test on anyone, and you can opt out. And if you opt out, then you'll fall into traditional quarantining methods. These testing packages are coming to us at no cost from the state. We just have to go through the process of signing on like we did last year. The team is comfortable with them, and they think they're good options for us going forward. And again, the fallback position is the quarantine if people don't want to opt into the test. Ventilation and cleaning, we were in very good position with that last year. We're just going to continue forward with those protocols. Those are all already posted on the site. After tonight, if we have a decision going forward, we'll reboot a new site for this year that just has all the live links. And hand washing and respiratory etiquette is another recommendation. Basic hygiene stations will be located throughout the building, and in talking with the principals, they feel like they have pretty means on how to manage that. Some consistent with what we did pre-COVID and a little bit more enhanced, but they're going to keep those in place to go forward. Our next steps, we actually have everything we need in place to open up the year with these procedures. The MERSD masking policy, you probably saw it flash on the screen before, is in play until rescinded. So you would have to actually vote to stop the masking policy rather than vote to re-implement it. So we have the policy in place to go forward. I'd like a vote of support, or tell me that you want me to go back and rethink it and give us some parameters to do so. That's fine too. But just to support the implementation of the DESD testing program, as well as kind of the general approach to the year. And then we would look to make this effective for next Monday. That's not a random date. Next Monday, we start on-site large groups. Sports are back. There really are no restrictions on sports for the fall because everything is outside. But we have class orientations, drop off for locker, checkout, and orientation groups are set up. So we just want to be prepared and get everybody off on the right foot for next year. So that's kind of a snapshot of the thinking. Seems like a lot more conversation went into this. And I guess I'm a little torn. I'm disappointed we have to be here again. I'm sure like everybody else. But I think to a person that I've spoken to, we have a handle on what to do and what works. So it's not that that heightened sense of learning, building the plane as we're flying it like we were last year. People are very confident in being able to implement this and felt like that can be done on the fly. So we're just getting close to the beginning of the year and we'd like some direction.
No.
Someone able to pull up our masking policy?
I can pull that up. Yep.
You want a motion?
I think
start discussion.
Well,
or-
no, I think we can have questions for Pam on her presentation. I open up to school committee questions for Pam. Or thoughts?
I have some questions, not even some of the testing. So the is also funded, and the availability of that is essentially as we need.
Yep.
And those are the quick ones, so you.
The BINETs, the rapid testing.
so students will have-
Yeah, so if someone gets sent down to the nurse because they're saying they have symptoms that are on the checklist, the nurse can offer the rapid test so that they can test and stay in school if they're a negative, or be sent home
Right,
if they're positive, and then we can go through and identify the close contacts and offer the test and stay.
right. I don't know if this is like at the discretion of the nurses, but if you have a child who on the MedBot has been identified as at risk, does that child then have to stay home until they're no longer at risk, or can they come to school and be tested so that they can go to school that day?
Yes. Both, depending on what the parent opts for, or
Right.
what that discussion leads to.
But so that option is available rather than having to call your doctor and
Mhm.
schedule an
But I
appointment.
think what people
get
would like to
tested
happen
week
is
or-
let's not send a potential
Right,
sick child into the mix and then just like find out throughout the process of the day.
right.
Yep.
So then,
The goal in all of this, like back to the original 3 goals, come to school, stay in school, both as a whole community and individually. Like,
right,
because last year there was a lot of in and out, students, staff, up and down, or the whole community. So the goal is to kind of get off on the right foot and get
Yeah.
everybody in, keep them here.
I guess what I'm getting at is, does this potentially eliminate kids sitting at home waiting for a test result?
That's the goal. I don't think we can ever eliminate it based on elective choice. But the intent is to try to keep kids from sitting at home during waiting periods, just.
Right, so if your
Just
kid
in
has a
case.
cough, you
Mhm.
can get your test at school and.
Yep. And I'm gonna trust the nurses if they feel like something is severe enough and they prefer that they see the pediatrician, that they recommend that with parent. If you've ever had one of the conversations with the nurses, I think they hear you, they listen to you, and they try and problem solve with you and not dictate. So I would assume that's gonna.
Teresa, I have a couple, yeah.
Yeah.
So we've had a lot of, contact from people in both towns, knowing that this conversation was happening. So I just have a couple questions that might help clarify for everyone. Last year, we sort of developed over the course of the first couple of months, a framework for an exit strategy. So that's one thing that I think people that have difficulty supporting this recommendation might appreciate is what are we looking for in terms of that? Is it a vaccination, percentage or that sort of thing? And I don't think we can answer it tonight, but I just wanted
If
to
I
know what your
answer
thoughts.
tonight, I would say I want people, I want the school doctor and the public health nurse to tell me it's a good time to start rolling back
Yeah.
masks.
So similar to last year, we're listening to the people in those positions who actually know so that we're not putting
With it-
our opinions on it.
Yes.
Okay.
Where we come in, where I think the school offers perspective, it's in that manageability.
Yep.
What is realistic to expect? When do kids need mask breaks? What does the structure of the day need to look like? So this is actually manageable for the teachers in the classroom and the students who are there as well.
Sure.
But in terms of interpreting the data and kind of the big picture of the state, listen, this has been cast upon us locally. Everyone's doing the best they can. There's a lot of inter-district conversation. I know school committee chairs talk, superintendents talk. If you would have asked me this in July, and I was probably saying this in July, we're on track. This is going to be awesome. It's back to normal. The DESE gave us what we needed in terms of, and it seemed like good guidance at the time and like we were going to be able to implement. As we get closer and more conversations are had, it just doesn't seem realistic to be able to implement the choice option right now.
And then the other two things which you may choose to set on, but questions we've had about it being detrimental, given that we're going back. But again, as you pointed out, we did the 5 full days a week in the spring. Were there any verifiable, and I don't mean by opinion, but detrimental outcomes to our having kids in school with masks with breaks built into place?
Not that I'm aware of, and we have the benefit of our school doctor also being fairly well very well-respected pediatrician.
Right.
So she is coming at it from that perspective
Okay.
and has not voiced any concerns. I know we received an article today through a submission, and I think through a little digging, I was sent the retraction to that article.
Yeah.
So, no, there is nothing that we're aware of physically.
Right. Yeah. Okay. Thank you.
And again, it's picking between the option of potentially reverting to remote or potentially setting up some students not to be able to access school. There is no perfect solution. That is carried through from last summer. We're really working to make the best out of a difficult situation. I think what we know is, I think we're going to have more upbeat energy and joy in the return to the year, and the activities and the structure of the day will be more like it has always been, and less kind of constrained and rigid. That we're just going to do normal school, but with masks and an eye to kind of keeping some elbow room between us.
And then my final thing is, could you comment on any discussion that I know has been asked of me about making different policies for different age groups? For instance, the high schoolers
I
who have
should have put
access.
that in there. So one obstacle we have is we run a 6-12 building.
Right.
So our entire 6th grade does not yet have access to the vaccine. So I wouldn't recommend trying to do a 2-tiered system within one building. I know Masco has gone with that option for their middle high school. At this point, they're 7 through 12. So theoretically, that whole building has access to the vaccine.
Thank you.
Go ahead.
Yeah, my only comment, citing the facilities maintenance and cleaning overview doc. I know electrostatic spraying is part of the efforts. And in reviewing your one pager going into they actually, I think, are now saying electrostatic spraying is not recommended as a primary method of surface disinfection. Potentially consider, I think they're still recommending it for potentially positive cases like in a classroom, but as a general, like, end of the day fogging or whatever, I think that's now discouraged so you may want to just consider.
Jason brought that up today, I think.
Yes, he did.
So he wants to
I think to the extent that the documentation encourages us to stop, specifically discouraged, and we would certainly take that under advisement. To the extent that it's no longer encouraged, it's in there currently, and that it allows us to have the same level and maximum level of cleaning at the end of the day. So we will make sure we get that nuance correct.
Yeah.
To make sure we don't do it the wrong way.
Ken and
So I do have a quick question, Sarah. In regards to the testing, actually, can you hear me okay?
Very.
you're allowed.
Okay, sorry. The testing that's referred to in here, this is the testing of students that go on. Is there still any sort of the surveillance testing that went on in the spring? Or that's pretty much wrapped up and done, or is that still going on in the background? That was kind of a look for asymptomatic individuals.
Available, but the was the cost benefit on that sheet, and that was due to lack of buy-in from parents. Going forward with cold.
How about for the teachers? Did they want to do testing or not? They don't want to do it either.
There's been no request for it.
Okay.
Okay, more Ken?
So the testing that's referred to is just what you had mentioned about for the medical staff at the schools to have. No, that's good. I just wanted to make the comment. I appreciate the kind of multi-layered strategy that we had. I know it's a disappointment. I'm back to wearing masks at work. Quite frankly, I'm looking forward to more of the stress of making sure I get Mr. Willis's new drop-off directions right on the first rainy day for school, rather than this. But I appreciate that this policy is geared at making sure the schools can operate consistently and that there are medical exemptions as needed. And we have a student body that has, for the most part, gone through and experienced this in the spring. And we managed to keep this at bay. And then we also have a way to roll back. So no, thank you very much for the presentation.
Eric or Chris?
Yeah, I have a couple of questions. Um, I guess two main questions, and these are probably just for you, Pam. But when you were speaking with our health team, was there any discussion about the general negative, like mental effects, or of wearing masks in school, and just kind of I think we can all sort of agree that there is at least some sort of effect there, on the mental health of our students. And I really bring this up more along the lines for the younger students as well, like especially K to 5, where they just, don't necessarily, they're not as mature, don't have the ability to truly understand sort of why we're doing this. And I don't know, I can bring up a very quick story. About I guess it was 2 or 3 weeks ago, we mentioned to our daughter that there was a pretty good chance that she would be wearing a mask when she went back to school this fall. And, she started crying, and quite a bit about it. So I just am curious if that was discussed much, and I didn't really see it at the very beginning as well. I didn't see it highlighted as one of our goals, if that makes sense.
It wasn't brought up as a concern from anyone, any of the nurses, the health team, or even from the principal group. And I think if I think back to our experience last year, the kids managed it well when we had them in school. There was a lot of fear that they wouldn't, that they would be resistant to it, that it would really become a daily fight. But when we position it that this is what the community is doing to help each other and keep each other safe, the kids were fantastic. I mean, my anecdotal information is just from, I'm in my office frequently later in the day when the kids are coming from practice, and even the older kids, once they knew what the expectation was, they were following the rules because they wanted to be here and be with their friends. So I don't think it's perfect. Quite frankly, I know the adults are quite disappointed with having to mask up. But I think what kids may not be able to understand, but if we carry ourselves appropriately, the trade-off is we can all be together, be enjoying being in a full classroom, doing regular activities, having rug time. And we have to hope that that's going to balance out feeling like I really, it's uncomfortable and I don't really want to be wearing a mask. But to a direct answer to your question, no, no one raised the emotional health concern.
Okay. And then the second question is, in the presentation here, it seems like, a majority of the recommendation is being made on guidance that is, a federal level guidance. So, guidance for, the United States as a whole. And I'm just wondering how much we're taking into account, the situation in our actual, district and community versus, and the reason why I ask that is that, it sort of seems to me that maybe at this point, or even possibly last fall, I think we were pretty much in the same situation where, I think the COVID positivity rate in the community was, close to zero. And if we were ever going to have a time when it was safest to, not wear masks in school, it would appear that this would be the time versus, say, the middle of the winter when there's also, multiple other respiratory diseases, that can spread throughout the school community, right? So I'm just wondering, are we basing the majority of our decision off of national guidance, which takes into account that there are, so many areas of this country that are in such worse shape than we are when it comes to, and not even worse shape, where there's significantly more risk, versus a community like ours where there seems to be, and again, I am not a, physician or a doctor, and I would not pretend to be an expert in that area, but it would appear that, we should at least be taking into some account guidance based off of our local situation.
Absolutely. And I think we have the DESE guidance embedded here, and their guidance is strongly recommended. They're leaving the option for.
Yeah,
some
that's
choice.
still state guidance though, right?
Yes, but in absence, of a city-sized Board of Health, everyone is relying on the larger entity to provide some guidance. Where I take some solace is two points that lend themselves to the CDC recommendations this year. The American Academy of Pediatrics was one of the underlying bases for our more localized guidance last year that came through DESE. And this year, they are choosing, DESE is choosing not to align with that recommendation, but that recommendation does align with CDC. And the current head of CDC was also a key contributor to the development of the state guidance here last year and is now heading up the CDC and that guidance that we received. So I feel that there are some consistencies with the development of the guidance that we are turning to with where we were last year. True to form, we're a little bit higher in terms of our requirements than what the state is absolutely requiring. And I mean, it is the state's no longer producing the hot map, but the CDC is, and looking at those statistics, we are in the high risk area in Essex County. So I think if I draw down to look, and our local experts are looking at what's in front of them and recommending that we go with this guidance. So I think that's how it's become localized. And
Well, Essex County includes a lot of cities that are in a much different situation than we are.
And I think we always consider that a lot of our employees live there. So we are interacting with the entirety of Essex County on a daily basis to an extent. Again, I'll fall back onto our most local recommendations. So they're looking at what's in front of them for town data, and we're having our public nurse and our school doctor recommending to go with this guidance.
Gotcha. And then I guess one more question, and this is mostly because I'm probably new. Would we have a path sort of laid out on, what it would look like, or what would need to occur for us to return, to a school year where there weren't any restrictions, and what that would look like? It doesn't seem like that would be part of, the decision tonight or this document, but I'm curious as to, how, what that would look like, or.
I think we would go back to doing a monthly report. So the first meeting of every month at school committee, we would kind of take a look at what we've taken a look at now and see if there's been a substantial change in the recommendation or the overarching guidance to see if we can make a move forward. I do think, you mentioned some of the southern schools that they go back at the beginning of August. So I do think everyone's watching them, knowing that it's a different climate in terms of vaccination. But what is true and what we still don't know here, and this came up on a statewide call yesterday, is that they're going back en masse to school unmasked and they're seeing surges. So
yeah,
think
that's not good.
So they're trending in the wrong direction. Where we're lucky, this is a horrible thing to say, but we have the benefit of watching what happens in their school environments and trying to be a little bit more preventative. So what I would really love to see is we start off strong. We don't see schools more regional to us who make different choices, having any problems. People get more comfortable with their understanding of the variant and can give us a little bit more confident, yes, go ahead and take those masks off. And we're at the ready to do that. We all want to be there. This is not where anybody wants to be.
Yeah. Of course, yeah, and thank you.
All right, I think everybody had a chance for questions. I would entertain a motion to continue, just a motion in support of our current masking policy in place to be revisited at the beginning of to be discussed at the beginning of every meeting when we hear an update on the current public health situation. Somebody like.
So moved by Warnock.
Any discussion? Or have we had enough? Oh, yes, we need a second.
I'll second.
Teresa second. Teresa Whitman. Any discussion?
I just want to acknowledge that I also want to be here making this right now. This isn't where we thought we would be in. We hear everybody who's saying that they don't want their children in school in masks, you know, on a personal level. I don't want my kids in masks all day. I have a child who literally does not remember school before he had to wear a mask, and he loves his mask. And if it were up to him, he would continue to wear a mask for the rest of his life. He would probably benefit the most from being in an environment without masks. But the reality is that schools don't exist in a bubble. We have staff and teachers who are coming from all over Essex County. And I think it's our responsibility to provide, you know, all students with access to in-person learning that is safe for them. And so I think that, you know, in making this decision, it's really considering how can we best provide an environment that is safe for all students and all staff members. And, you know, you hear what people are saying. I don't want my kids in masks either.
In the category of discussion, should, once we vote on it, should it pass that we continue to move forward with this, who should people contact if they have concerns about this? Either from a health perspective or personal opinion.
So tomorrow afternoon, I'll send out a notice of whatever our decision is and our game plan for going forward with the, with pointing parents in the direction of their principals for how it will start to play out in school. There really shouldn't be all that much new for folks. And then they can either contact the principal if it's a, how do I manage my student and how do we manage the day? Or if it's a policy issue, they can always contact me or Sarah. If it's a global school issue, they can contact me. And if they're not sure, they can contact me and I'll connect them with who it should be. But principal is probably going to answer the day-to-day operational questions the best.
Since it's COVID procedures, I do just have one other thing. In terms of the buses, could we just clarify the situation that comes from, where that comes from? And also if we're revisiting that 1.5 to 2 mile bump that we had dealt with last year.
Buses are mandatory masking consistent with CDC and the state guidance.
With windows still down.
Yeah, the windows will be down. I have spoken with the bus company, subject to extreme weather conditions. That's the information we put out in the registration documentation since last year.
And I saw that the registration just came out tonight. So are we not revisiting that 1.5 to 2 mile grouping of offering?
Yeah, so if you look at the guidance, and certainly we can talk about it, but if you look at the guidance documents, what it basically tells you is what you need to do is the masks, a proper ventilation, and getting kids to school in terms of any distancing. That's, and other items that might have been there in fall, those are no longer part of the protocols. So we are going to be running the buses the way we used to run them, subject to any other discussion that might come up here, but that's the intention.
Sorry, I might have been mixing this up. I mean, of the people in the 1.5 to 2 mile range.
So yeah, that's what I
Okay,
mean.
that's
So,
what-
and so, yep, so just to spell that out, sorry if I stopped a little early. Yeah, so as a result of opening bus service to everybody, it does allow for the traditional service. Last year, we did actually only 2 miles and above. This year, we're, like I said, back to normal, which means we have a free service for those folks who are 1.5 miles further, as well as paid service. That's an option for people who are less than 1 mile.
Thank you. And are we doing late buses this year? Is that all still part of the thing? So we're just back to normal busing?
Everything is pretty much back to normal, except we're going to wear our masks.
I love
you, elbow. That's what I'm.
Thank you for clarifying that.
No problem. And that's consistent with the same thing that basically the Department of Ed is pretty clear that kids, we need to do everything we can to get back to school.
Yeah.
I'd say the one other thing that we were talking about, and if we are in agreement tonight, you'll see communications from principals. We really want an opportunity to have in-person open houses. But when you start to get to the 500, 600 people in a building at the middle high school, it gets, now we're into the volume issue. So we're going to postpone and look at end of September to beginning of October. Hope we learn something in the first 2 weeks. So we're able to do in person, and if not, we'll revert back to a more virtual style like we did last year. But we kind of want to see how things develop, because if we spike and then start coming down, we might be able to talk with our folks and get the blessing going forward. At this point, the game plan for opening day will be kind of a picnic on Highland Field with the full 250 staff members. us to use outdoor space for our really large groups.
Any more discussion? I feel like I haven't said much, but everybody's said so many things. But just to echo, we do hear people's concerns about children wearing masks all day, and it just seems like the need to continue to have all the layers of mitigation in place that we can in order to keep everybody in school seems like what we need to do. So let's go ahead and take the vote if there's no more discussion. And I think we should do a roll call vote as we do have some of our people virtual. So I'm just going to go around the table, not in alphabetical order. So Teresa?
Yes.
Kate? Matt?
Yes.
Ken? Ken, are you a yes on this vote?
Yes, sorry. Microphone.
Eric, are you a yes or a no?
Yeah, I am a yes. I understand some of the concerns, but I'm a yes.
Yes. Oh, Chris, are you frozen?
No, I'm here. Sorry. I'm no.
And I'm a yes. So the motion to support the current mask mandate carries 6-1. And then we are also looking for, we need a vote to implement the Binax Now diagnostic testing program. So could I have a motion for that?
So moved. Warnock.
We'll give Ken the second, that's fine. All right, any discussion on the implementation of the diagnostic testing program? Okay, let's just go ahead and take the vote on that. Teresa?
Yes.
Kate?
Yes.
Matt?
Yes.
Ken?
Yes. Yes, did you get that, Ken?
I got Ken.
Sorry.
No, that's great. Eric?
Yes.
Chris Reed?
Yes.
I'm also a yes. So the Binax diagnostic testing program passes unanimously. All right, thank you. Again, we're all disappointed in the mask situation, but feel that maybe this is what we need to do. Keep kids in school. Moving on.
Is next on the agenda the
Update on strategic planning and a review of the core values.
we just quickly search for that document. Okay, so as we are heading into the school year, our goal is to have our strategic plan and district improvement plan before the school committee in September and finalized by our second meeting. So that'll put us at third week of September. So we can start school councils working on their school-based plan that is supposed to reflect the overarching goals. One piece of business left over from the 3rd of August is just a finalization of the core values. There was a team that was working on language to ensure that the core values reflected, were still in alignment with the work that we had identified to be done. If we can close on this tonight, we'll package this with some of the top level work that was done. We had a 2-day leadership conference and continued our work with Creative Ed Foundation, took all of those mind maps and all of what's from that strategic planning input session throughout the spring and kind of crafted 3 to 4 top level objectives from that. We're going to go back to that group now for some feedback and we'll bring it back to you in September. So we've got some work to do. As always, COVID throws us off about a week or 2 from our intended schedule, but we're going to make good on it. So when we talked with the leadership team, the assistant principals, the directors, the principals, the one recommendation they had that I'd like you to consider is we had community partnerships. They're recommending we make it family and community partnerships because we felt that it's implied there, but family is otherwise absent as a stated goal. And it's something that we're looking at goals around. So I thought it was a great suggestion and said I would bring it forward here. Other than that, everybody feels that these capture the sentiment of the work, that they're well aligned with the goals and what the desired, what the identified themes for improvement were. And that they actually don't stray too far from our core mission, which we all felt was good because our core work shouldn't really change drastically over time, although it may have different applications. So I think we're all on the same page and we give you adding family partnership goal.
I love that.
And that was so much of the discussion throughout the whole thing. So it makes sense to have it reflected in the.
All right, so if we want to give this an official thumbs up, we'll integrate it into the strategic overview. That'll come back to you at the next meeting.
Awesome.
Can I have a vote?
Yes. Okay, I've looked at this so much because I've been working on the language. So we all had it in our packets. Did everybody get a chance to look at this? Enough. Okay, we can vote and then discuss. So does somebody want to make, I mean, we can get a motion on the table. Does somebody want to make a motion to approve the mission, vision, and core values statement?
So moved, Burke.
Eric moved and Teresa seconded. Can we do that? Okay. Any discussion or questions on the mission, vision, and core values document?
I'd like to say something just real quick. I think I may have mentioned this in the very first school committee meeting I attended as a member, but I do just want to reiterate how important I think it is to make sure that, you know, this document makes it out into the community, you know, and our roles of ensuring that that does happen. You know, this is only as good as we make it and make sure that, you know, the community understands what we're, you know, looking to accomplish, not just as a, you know, committee, but of course as a school district. And I just think that's so critically important. So want to make sure that we are all on board with that as well.
I think that's really important to bring up, Chris. Thank you. Anybody else want to weigh in on these? Should we read them out loud into the? We don't have to read them out loud in the meeting. Okay.
And to Chris's point, our next stage, once the approval, is going to be the communication. So that might dovetail nice school committee goals and then the school committee goals with my goals. And taking this version, because some of us like, I think I'm learning, some of us like words and some of us like a more condensed. We're going to have a little bit of a differentiated approach to being able to communicate them. And once we've agreed on the words which reflect the sentiment, then we can kind of look at some graphic design.
Yeah. I really like the way, I know it was a long process, the way we went through a long process that involved, you know, a survey that included over 700 members of the school community and the broader community to get everybody's input, and that there were a lot of people who participated to boil, and then we like boiled all that information down and distilled it into this document that is the mission, vision, and purpose.
Sarah, I just want to make a comment. I agree with that in the process, and I thought this was valuable as a school committee member who was not around when the prior mission, vision, goal, or core values were in place. We were both different, but also mainly consistent, I think, with where we came out. There was some rewording, but the general vibes and feelings and stuff, it almost, I think it was a useful reaffirmation of where we were, stated with some different words, but covered a lot of the same ground. And it felt like it refreshed it for me, and I think the other participants in the meeting.
With some folks earlier, there were some concerned citizens from Essex that some of us met with, and they were talking about how great the schools were when their kids went through, and they just think it's a wonderful school district. And I think we do too. And I think that this document really just kind of affirms that it was great before and it's still great, and we've got some work to do, but we're in a good place. And I think this document really shows that. So.
And I'll just chime in that the leadership team felt exactly the same sentiment, which was, it was a reintroduction to our core beliefs. And when we were starting to distill all of the mind map inputs, landing on kind of the key strategic initiatives, people felt very much like we're all on the same page in a strange way and inspired by the work to come. So to Chris's point, it's giving a bigger mission to the detail work that we're so mired in every day. So I'm excited about getting it packaged and in front of the public.
Awesome. Any other discussion on that mission, vision, and core values? All right, so let's vote to approve this document. Teresa?
Yes.
Kate?
Yes.
Matt?
Yes.
Ken?
Yes. Yes. My audio may be slow to respond, but that's a yes.
Waiting for Eric.
Yes.
Yes.
Mission, vision, and core values document passes. Thank you, everybody. All right. Oh, our goal setting. We rolling right into that tonight.
So I included in your packet our goals from last year, kind of as a jumping off point. And I didn't know if you guys are up for your initial discussion and what you think our goals, what you think the committee goals for this year look like. And it could just be a brainstorming session tonight with kind of them solidified over the next 2 meetings along on a parallel track with the improvement plan.
Yeah, I mean, it's pretty early. Let's take a little time to brainstorm and go through these. So the first one from last year is to target resources to support the unique educational, logistical, and social emotional needs of students across the district during the COVID crisis.
I'm looking at a different doc.
Oh, I'm looking
Yeah.
at the ones that can't.
I think that was maybe.
This was a draft from, I'm sorry, my B.
Does everyone else have provide for the health and safety? Okay.
Okay, sorry, I'm gonna find it here. Teresa, can you read that?
I
first
can.
one? Thank you.
Provide for the health and safety of students and faculty while maintaining the robust educational program MERSD and our member towns value, specifically during the COVID crisis. I feel like we'd be here with, I feel like we should probably keep that one.
Yeah. Teresa's recommending that we keep that goal just as is.
I agree.
Official thumbs up.
Official thumbs up. How about the people joining us, the school committee members joining us remotely?
We've lost this.
I like it.
Yes, agree.
Everyone agrees. Let's leave the first one as is for now. Teresa, can you go to the second one?
Manage the district's budget and budget reserves, allocating resources for both near and long-term financial health of the district.
Well, I think we always have a finance goal on the goals, and I think that's a really good goal. I mean, Teresa and Matt, you've been sitting on the
Ken, do you hear anything?
I do not. I think we lost audio from the.
Yeah. It was weird when we were voting too.
Yeah, I don't hear
Yeah, it
anything.
would cut out.
Yeah, the room would cut out. We'd be fine.
Yeah.
Okay. So just texting Sarah. Say we lost audio from her end.
And video. Unless you guys see the video.
There's a little triangular with an exclamation point on there, which I assume must mean some sort of an error on their connection.
Someone didn't pay.
I think they're coming back, I think. We can sort it. Yep. It sounds like you're back almost. This would normally be, if I was in person, this would normally be me kicking a critical plug out of the wall, yanking a cord by accident.
I still see the triangle on Pam's window.
Sarah responded that they're working on it.
Yeah.
Got low
He
bandwidth.
logged in separately too, and he's not there either, so.
I'm getting a low bandwidth sign.
Sarah, I mean, any one of us.
Bobby's back.
We've got audio back from the Warren and Commons. All right.
Cool.
Okay.
All right, so continuing, I guess I was saying, my point, from my perspective, it seems like a pretty big goal of us in terms of budget is to establish those relationships and build on that. But I don't know if it needs to be included in our school committee goals. So that's what I'm looking for.
I think we could add a sentence about working collaboratively, something in there. Yeah? Thoughts? Like,
Well, I think
Or
that there might be
continue
an
to build.
overarching communication goal that covers that and covers some of the other messaging.
okay, so let's put a pin in that, like possible add something about working collaboratively. But also add, make sure that we're also talking about adding maybe a separate goal on communication, a communication
Yeah. I
in
think so.
general, yeah. I'm having to do this with annotating the PDF, so it's a little dicey. Okay, great. The next one is continue to manage the construction of the new memorial school, ensuring it remains on time and on budget, ensure parity between Essex Elementary School and Memorial School in key facility-related areas in order to maintain educational parity, technology security, and playground, plan and execute construction of the Eagles Nest Playground. So these are mostly rolling off, except, so we could just keep out that, I mean, we need to keep this, ensure parity between Essex Elementary and Memorial School in those key, that sentence in the middle should stay in.
Want a recommendation?
Yes.
Yeah,
I would like the group to consider elevating, begin pursuit of the new Essex Elementary School to a goal. It'll be a multi-year goal. But the technical, more, I mean, there's still closeout work to be done, but we've delivered, the committee's delivered on its piece of the project, which is getting the community support and funding, teams doing the technical work. I think our next big lift is going to be making sure that Essex is addressed in a timely manner. That's how we're going to get to the parity.
Pam, by way of reminder, typically from the point at which we begin the process, if I remember right, it's getting on the list. It could be typically minimum 3-year process to even begin to get to the point where we have a budget and established and a capital plan framed up to take to the towns.
I think one of the, what happened with was we got into the pipeline. First piece of education is we can't guarantee ask to be in the pipeline is going to be granted, because that's where it is competitive with other communities. And it's basically you're building on a rubric against other buildings. So I think creating a timeline that allows for the need for a couple of SOI submissions, then from SOI, meaning they invite you in, then it's about 18 months to the feasibility study, correct? Which is the first financial apps, from both communities to fund a real deep look into the project. So that's kind of like the straw poll for whether or not we'll have support going forward. And then I think we said the other day, we've been with Doran Whittier for 4 or 5 years now. And that's been the length of the project from feasibility through completion. So I know there's some discussion about where, 10 to 15 year period this should fall. When we started with the Memorial School, we started timelining for people and giving scenarios. So I think if we set that as a goal, timeline could be an ongoing part of our discussion this year.
I think that's really important. And I was actually talking to some of the leadership in Essex who were newer, and so they hadn't been around when we had the whole Habib report. So we just really need to revisit the history and the needs that we have and start going there. Yeah.
You will see that come forward on our plan as one of the first tasks we want to do this year is a Habib report too, not necessarily with Habib again, but that style of report. And instead of Memorial and Essex, this time it would be Essex in the middle high school. The timeline consideration, we look out to 2034, that'll be 20 years. The debt will roll off, but it'll also be kind of a milestone in terms of what it may need in terms of a facelift and some internal work for its infrastructure. So if we can have that roadmap that Habib gave us for what systems are imminent and where's the money going to need over the next few years, that can help us build a case for different asks.
All right. This last bullet that we have is addressing the anti-racist policy. And I think this one really, honestly, it really needs to be reworked. I think it needs to be a diversity, equity, and inclusion goal. And I don't know exactly what it needs to look like, but I think it needs to look really different than what we have here now. So, I mean, I would like to start work with maybe like some help. Ken, go ahead.
I was going to say, I agree with the rework and the reframing, and I think we got a start toward. I liked how the language came out, and on my screen, I just scroll up to the mission vision statement, because we have a statement in there about maybe can we just quickly revisit that statement, because it's at least a little cleaner. Maybe use that as a starting point.
The equity goal.
The equity goal, that one says,
It says, we believe our schools must strive to create a just and equitable environment that respects individual differences and the diversity of our communities, country, and world. I don't know. That was just one thought for a starting point, and build off that to something more concrete or wherever we want to go.
Well, do we want to single that one out, or do we want our school committee goal to reflect what we've been saying, which is that now that we have this mission and vision and value statement, a communication goal about that, about that generally.
a communication goal about communicating our
values.
Yeah.
And what we plan to do with them, so that the community understands what the purpose here is.
A new communication goal regarding these values. Oops.
Yeah, because this piece here is going to be, so I'm had a couple of initial conversations with Michael Eatman, who is going to be available to meet with Sarah and I, just talk about coming in and assisting us in this work. So the working groups and the education piece is going to be part of more of our checklist of district deliverables. So that's in play. And that's the first step to realizing the whole resolution, right? Is laying the foundational work. So the communication piece may be kind of the public outreach goal.
Yeah.
Because our work, which I truly believe in and is really good work, and hoping we're getting past COVID and can focus on that. If we're always in a battle, a misunderstanding, it's gonna dilute.
And it's embedded in that mission, vision, values.
All right.
So we made our goal for last year. Have it'll be a little bit more than a year, but the pieces are in place that you wanted to have in place.
Do we have then separate budget goals underneath, because we had a separate budget goal for COVID. Wait, why do we have all these? Okay, we had a whole separate set of budget goals.
These here are the budget goals that are kind of the standing budget goals.
Under the line there. Okay. And then do we think, given the situation, do we still need to maintain a separate COVID budget like we did last year? Like we kept a separate COVID cost? I think we do.
I think until we know otherwise.
Yeah,
I would say we're not fully out of the woods yet. We've got some more federal funding that we're going to be working through. We're still collaborating with the towns about how we might partner on some of their grant funds. And so I think the work isn't done. I'd say a large portion of the spending is behind us, but yes, I would agree. It's good to have. And hopefully this will be the last year.
so so those two at the top were like added. Usually we just start with the ones at the bottom, like have a fiscally responsible budget.
And it's okay if they work.
Yeah.
Right, I don't see any
Yeah.
that stands out.
The only one that you might want to toy with is the first one. Because we are talking about a republishing and discussion around the mission, vision, and core values. We use language that kind of alludes to that, but we don't really say it in there. And do you want to just embed that? Essentially, we want a financially responsible budget that strives to meet our mission, vision, and core values.
Yeah.
Or that
Yeah.
supports our
Yeah.
mission, vision, something along those lines. And I think this is something that we don't need to answer tonight, but I know we've debated this on and off over the past. Does this confine us? Or is it really just a good public policy statement that we recognize the confines of 2.5 and we try to work within it? So I'm just gonna throw that out there for consideration, and I could make an argument both ways.
I kind of just want to change the word confine. Like, I think we need to recognize that the towns are dealing with Proposition 2.5, but I think maybe it should be slightly different wording. Like, we recognize that it's an issue. The issues presented by Proposition 2.5, because we know that this is an issue, but I don't think we should always be letting it totally confine you.
In spirit of
The
the
concerns that
confines
come
of,
with-
it's like we recognize probably.
Oh. Take that.
So I guess two things to consider that are embedded in my brain. The town doesn't really operate within 2.5, they really operate within about 4%. And very rarely do we bring an operational budget that asks for a 2.5% override unless it's been a multi-year discussion of our either increased need or inability of the towns to pay. So
Maybe it's not even recognized as the issues. Lines of- Just, maybe we just leave it as fiscally responsible.
or do we go back to our core values and look at our resources?
Traditionally, this budget goal has made an attempt to understand that it's a balance between competing forces and that we have two jobs to do and we have to do them at the same time. Doesn't necessarily constrain us in any given year to one side or the other over the other, but that we kind of go into the process understanding that both sides are important. So I think that's why it's worked. And I think with Proposition 2.5, it's not 2.5% growth, it's Proposition 2.5, which allows for new growth, getting towns to higher numbers, like, sometimes the 4% that Pam's mentioned, or whatever the number might be on the town side. So just throwing that out there. I think it has been a longstanding goal that Proposition 2.5 overrides, for example, are not something that happen with frequency. So we still recognized Proposition 2.5 while understanding that it may not apply to every single year in perpetuity, but it's something that is an overarching, I don't want to say confine, rule of the road according to the Department of Revenue. So it can be there without us having to necessarily say that there would never be an override. So again, the balance, I think, accomplishes a lot from the work that we do in the budget season, but it's really a school committee policy decision.
As a budget goal, I wonder if now, I kind of like the keeping recognizes the confines of Prop 2.5, given the climate we're dealing with the different within the collaboration groups and the committees. I think it's important that we keep wording in there that establishes that we know this is a thing. So I don't know that I'd be in favor of changing that necessarily, but I do like fiscally responsible budget that supports our mission, vision and values and recognizes the compliance.
I like that. Do we want to maybe just go very quickly, look and at our core values and make sure that they're all reflected in our goals in some way that we're happy with? So do we have a goal, student-centered, do we have that in our goals? That's the first one. The equity one is kind of the student-centered is different than equity. It's a separate thing. So the student-centered one is the safe environment that supports the development of all students. Schools must engage all aspects of a child's development, including knowledge, a sense of self, emotional well-being, physical health, and skills and strategies to negotiate an ever-changing and unpredictable world.
Maybe the COVID one. Right?
Do we have to make sure each one of those things fit in our goals though? Because I feel like, isn't our goal this year to make sure that people understand what this is and that that's
Yeah.
what's happening?
Yeah, we don't have to, but
You can just
I'm not
gut
saying
check
we don't
them
have to.
against like whether or not you feel, is there any
Yes.
goal that isn't?
that's what I was
Is it
thinking.
represented?
Is there any,
Gotcha.
yeah, is there any goal
Gotcha.
that doesn't go with these? So
Okay.
we've got student-centered, student achievement, equity, family and community partnerships, which I think the communication really goes to the family and community partnerships. And we've got an equity goal. And the budget one really goes to the resources.
Student achievement.
Do we want a goal about student-centered and or student achievement, or do we feel like those are, I mean, that would be kind of the first one,
Yeah.
but we could maybe add something into that first one about student-centered or student achievement.
But what are we gonna do about that? That's my.
Right,
if
how
we're gonna
is
make
that
a goal, what
actionable
is
by
it
the school
actionable
committee?
for us?
Well, we've seen through some presentations, there's learning loss as a result of everything that's happened over the last 2 years. Maybe just like that we see it again, see the data again, like that we're not monitoring it, but at least keeping that in the forefront. Because that is one of the biggest ramifications of the pandemic.
Could we provide for the health, safety and academic and achievement of, you know what I mean, just including that in during the COVID crisis?
We don't need to make it all perfect right now, right? We're just gonna bring.
Yeah.
So support student chief, and then student-centered. I really like the student-centered core value.
I feel like maybe one of our goals should be to, maybe it's just personal school committee goals, but to really know and understand and this document, that it's kind of, that should be our goal. I mean, I know we can read it and understand it in that way, but understand how it's applied and what's being done with it, so that maybe it's the things that come, you know, the improvement plans and things.
The mission, vision, and core values.
Yeah, I feel like maybe I'm looking at the school committee goals in a different.
I think it's good to
way.
have a fresh look and looking at them in a different way. So I appreciate that.
And I think you can tie student achievement to one of your primary responsibilities, which is budget. Because if you look at the tail end of our student achievement, it's beyond the core. Right, to include experiential learning, the arts, cultural awareness, physical and emotional, social and emotional health. So like the pre-conversation that we had, we talked about the program, so we've got to articulate what the program is, but as soon as we get into these, can't you shrink the school a little bit to make it fit into the budget? That's the list of things that are in danger,
right?
Because people understand the core. They understand like reading, your writing, your arithmetic, taking the MCAS and getting into college. But these are all of the things in the modern education environment that allow for those successes to happen. And give kids opportunities and pathways. And that district,
And that our communities expect.
and that strategic plan is laden with not personalized learning, because we try to stay away, but options, opportunities, pathways, multiple ways of achieving, multiple ways of pursuing education. So the one size fits all, which is the most efficient, is not going to be where we continue to live and make good on what the community is asking for us, from us.
So I like putting something about supporting student achievement in with the budget goals. And I think it would fit well in that first one, where it says maintain the robust educational program. But we could maybe wordsmith that a little bit so that it brings in more of what we have in our student achievement goal now.
Right, and not just being.
I think we tied that language into some of our sub goals that are related to resources and improvement planning process. We started naming student achievement specifically. So that money just doesn't exist as a thing we want, that it's actually tied to a thing we're being asked to do and provide for the community.
So I think that's been some good brainstorming and a good start. And maybe somebody would like to work on wordsmithing out what we've talked about tonight. I have it all in a really messy document here. Would anybody like to work on that with me? All right.
I like words.
How about me and Kate take a look at that before the next meeting and we bring something together to look at as a group? So then on our list is the $3.5 million Manchester Memorial Elementary School construction bonds. Abby, you sent us language about that.
Yeah.
Do you need us to make the motion
Yeah.
with the fancy
Yes.
language you sent?
Yes, so, just because we are having, public session, I want to just make sure that everyone who's on the call very briefly understands what's going on with this process. I know everyone has heard many times that the project is on time, and under budget, which is true. We're on budget, but it's really, so far still under budget, which is great. That's relative to the $52 million project budget that was voted by towns. In addition, the towns both voted to borrow money, whatever we don't get from MSBA. We call that the district share, the part that MSBA does not fund, this is our share. And we pay for that through long-term bonds. We issued 35 million of long-term bonds about a year or two ago. And when we went to town meeting, we told people that it could cost, at interest rates of about 5%. And so that's the 52 million is how much it costs to build. There's also the cost of all the interest payments over time, and that's a real cost to taxpayers. And so the good news is that the interest rates have been coming in at much, much better rates than we anticipated. Memorial project, the 35 million that we issued before was in the low threes, and this one is in the 1% range for interest rates. So things are great. We're really benefiting from a couple things. First, the market is terrific for borrowing for municipal issuers right now. Two, we talked about our bond rating. It's very high, AA plus, one step below AAA, and they like the way we're handling the budget and the support we're getting from the towns. So with that said, tonight's job is to vote to approve to accept this next phase of borrowing, $3.5 million. That would bring total borrowing so far to $38.5 million. Not all of that gets paid back with interest because we get some of it up front in premium. So I'd just like to see if we could get a motion to move the vote as put forward by bond counsel Locklord in the documents that we provided previously, which basically fits the district to pay. The actual amount of borrowing here, is 3.5 million issue. We get some of that in upfront cash, is 3.23 million. The upfront cash is known as premium. So the actual bonds for this will be 3.23 million. But the whole document that we sent around has all the required language that I would ask to be entered into the minute.
I'll say so moved, but that was a long.
Yeah, sorry.
Do you want Matt to read it in, or is it okay to just do it?
I think in the past, we had to read this and we've been told that we no longer need to, and it's 3 pages. So I think
Okay.
we'll spare everyone
Excellent.
that pain and misery.
Excellent.
Just ask to vote the the motion to accept the vote as presented by bond counsel and distributed.
Okay, so we have a motion from Matt. Do we have a second?
Warnock seconds.
Okay. There's a little bit of a lag, and so Ken always jumps in to second after Teresa seconds, so it's very funny. Okay. Any more discussion?
I was wondering if Avi can refinance my mortgage into this as well.
Indeed.
And it is the 1.05, right? From
That's the
communication.
net interest cost is the rate. Thank you. I was
Okay.
trying to pull that up in time.
That's
Yeah.
it. Yep.
Yeah, it's an amazing rate.
Yeah, that's amazing.
And this is a 20-year borrowing. That's the other thing. A lot of our issues have been 30-year. Because of the size of this, we can pay it down quickly. And it will also be structured in a way where the amount we owe goes down every year, which also has a lower cost over the life of the bond. So we did a lot of strategic work with the town finance committees to make sure that we are really minimizing the cost to taxpayers across interest rate, structure, time frame. So this is I feel like this is very good news.
Thank you so much for your work, Avi, and thank you to the town finance committees for working on that with us. Any more discussion or questions? All right, so we will vote by roll call. Teresa?
Yes.
Kate? Yes. Matt?
Yes.
Ken?
Yes.
Yes, thanks, Avi. Great work.
And yes, Avi, this is great news, great work.
And I am also a yes. So the vote to approve the bonds passes unanimously.
Thank you. Missing someone.
Okay. I don't have anything else on my list. Do you have anything else on your list?
I don't.
School committee comment?
That one.
I have one thing actually. My thing is that now that the rule for having people in school changed about our meeting, our next school committee meeting, which is not until September. Yes.
We can do whatever.
We can still do a hybrid meeting.
You can do hybrid.
It's through
or you-
April, I think, of next year.
Yeah, or you can do completely remote. Towns are split on how they're handling it. So
You mean completely remote, like we could be all remote like we were before? Is that okay now, again, under open meeting law? Because I thought for a little while it wasn't.
I think the guidance is through April of next year.
they were going to rescind it, but then they extended it.
That's 3 weeks away, so we can make a decision and we'll just post whatever we're doing. Does anybody have strong feelings?
Yep.
Okay, okay. Strong feelings about how we should handle our next meeting. Teresa, go.
I'm in full support of having a virtual meeting. Not forever.
And I would offer, it doesn't even have to be COVID driven necessarily. I don't think.
I like the idea of, we have so much more participation, but the hybrid thing is a little distracting.
My game tonight, because I was trying to add in the projection screen. So I think the good news is everything that was happening on my screen was not happening for everybody at home. Bubble. All of a sudden it will pop up with the headlines.
I think
So, it's up to this group in terms of scheduling and what works and whether or not this new format is something that works for you, because that they may revisit it again because of they're hearing a lot about increasing participation and people easily able to access.
Virtual, anyone else?
I also like it's more comfortable, more
Feeling you a little.
I just have to say, I do like the hybrid, and it is interesting to watch the owl. It feels like I'm in the brain of a 3-year-old whose attention is always twitching around, which is surprisingly like mine at times, but different feeling. But it is good to see everyone in the panoramic view as well as have the zoom in.
I get screen fatigue much greater than in person. I'm fine. I actually don't have a strong opinion either way, but
I'm kind of fine either way too. Eric or Chris, do you guys have strong opinions about our next meeting or meetings in general?
I don't have a strong opinion. I mean, I like being there with everyone, but obviously, when you can't be, this is very convenient. So
Yeah, is that the Tuesday?
It's Tuesday after Labor Day break.
Yeah. We start before Labor Day in the Manchester.
Yeah, we're back at it on August 30th.
The participation is maybe we could consider.
Oh, it is.
Sometimes, because some of the presentations, like the principal's presentations, are probably nice to have in person.
Yes. So I guess we'll just, maybe we'll just make that call, you and I, as we schedule the meeting, because it seems like
At least just like the schedule.
our Tuesday meeting is currently scheduled for Rosh Hashanah and we need to reschedule.
So I will date. We could bump to going Tuesday, but we'll be in conflict with building.
That's 4 weeks between, we're already at 3 weeks between meetings.
Does it have to be a Tuesday?
And the
You could
other
observe
town
Rosh Hashanah.
committee.
We could go with,
It's the
No, I
second
think that's
night
a-
of Rosh Hashanah. Some people only celebrate the first, and so you may have a lot of people not even at that level of celebrating 2 days, just throwing that out there.
I think that's a reasonable, observance.
yeah, I mean, we could just bump to Wednesday on that week.
Is Wednesday,
Or
is
we
it,
could
is,
bump back.
but is, forgive my ignorance, when does Rosh Hashanah end?
Of Wednesday.
The evening?
So it starts Monday evening, and a Tuesday day is day one. Day two is Tuesday evening and Wednesday day. By Wednesday evening, it's over. And I don't know how many people celebrate 2 days. May not be many. I do.
So what we could do is either move to the next Tuesday, move to the Wednesday night. Because we're going off night, maybe that's the reason to do a virtual. Make it easy to accommodate people's schedules. I think there's a lot of different options. I would say we could even back up to the Tuesday before. I
That's
don't
the
know-
night
that's
before the first day of school, so I don't think that's a good idea.
And I don't know how much will evolve between now and then, because it's kind of just everyone's full steam ahead getting buildings ready. Operations stuff.
My druthers would be the evening of the 8th, the Wednesday. If that works.
Doesn't matter to me, but I think we should observe.
Yeah, I agree.
Sorry for that oversight. Okay.
Okay.
Everybody okay with that evening of the 8th for our next meeting to allow for the observation of Rosh Hashanah?
Fully remote.
It will be fully remote.
Yep.
It will be it will be fully remote. It will, I'm fine with either. Matt and I will come here and be remote from the library, from the Learning Commons.
And then by the second meeting,
The
we'll
sec-
have more, we'll know how the start of school has gone, and so that'll be.
The second meeting will be the 21st and we will make a decision. Okay, so our next meeting will be for sure, or do we need to, will for sure be the 8th?
Unless I go back and see something on the calendar that's a shocking conflict.
Our next meeting will tentatively be on September 8th rather than September 7th to accommodate for Rosh Hashanah, and it will be at 6:00 p.m. And it will be fully remote because everybody is just going to be beginning the school year, and we think it will be easier for people to participate that week from home. How about that?
Yep, and it looks good. I don't see anything on the.
Okay, oh my gosh, it's 8:00. Any other school committee comment to end the meeting?
Just one, is there an update on the Eagle's Nest? I know we got one on our August 3rd, but.
Yeah, you mentioned
Did we just,
before.
you just did that?
That's
I
okay.
missed it. Nope, that's good. I
It
will
hips in.
revisit the minutes.
Great.
You can watch, you find the recording.
I will find the recording and watch it. I missed that.
Share your presentation.
There's
The,
a little bit of.
no, surfacing is Memorial School. The surfacing is in.
Okay.
It's done. The surfacing is in.
I like starting your arguments.
Very good. And structure has been in already, so it's great. All the training stuff is way in the past too. Thumbs up.
And those kids are going to be able to take off their masks and play in that because there's no masks needed outdoors. Lovely. Lovely, lovely. Okay, any other school committee comment?
Big fan.
Motion to adjourn?
So moved. Did I beat Teresa?
I sat silently, no.
Second, Burke. Teresa, I beat you too.
Ken say yes.
Yes.
Eric, are you a yes?
Yes.
Yes.
And thank you, everybody, for coming.
The hardest vote.
Have a good night.